Hi docs, this is Technique 3. I'm here to give you more information about the Webster Technique and how you could explain it to your patients. Now this is also, because this is YouTube and you happen to be a lay person and you want to understand more about the Webster Technique, we'll get some information there. And if you're a medical provider, an OB, nurse practitioner, midwife, and so forth, we'd love for you to understand also the Webster Technique and how effective it is. It is a chiropractic technique, a specific analysis, specific sacrum adjustment, relaxation of the uterine walls so the baby actually naturally gets down into a head down position. So how do we explain that to our patients about the Webster Technique? Basically, we do know that at the 7th month, the baby should go into a neutral head down position. But sometimes what can happen is the baby literally gets caught in the wrong position or in uterine constraint, and the baby can be in a, fetus can be in a transverse lie, face or brow, or complete breech where head is up and the buttocks is down. And what happens there is that sometimes they'll wait to the very end to see if the baby will naturally flip, but majority of these women are going to end up with a C-section, and most women, if they're given a choice, they would rather have a natural birth for themselves and for their child. So how did the Webster Technique become so effective and so forth? Very simple. What Dr. Webster discovered was that if the sacrum was in rotation, and I'm talking slight rotation, and I'm going to use this little netting here so I can do it a little bit more in a layman's term. The sacrum with the iliums are basically like a basketball hoop, and the muscles and ligaments anteriorly in the front are those that are going to adapt or accommodate if the pelvis is in the wrong position. So if the sacrum rotates slightly, then the muscles and ligaments anteriorly begin to rotate, and literally the baby gets caught and can't get down into the head down position. So what Dr. Webster discovered, he did a leg analysis so he could determine if the left or right side of the sacrum was rotated. He gave a very specific chiropractic adjustment and then did a light ligament contact anteriorly to relax the uterine wall. And as a result of that, what would happen is that everything would relax and babies literally would flip down and get down in the head down position. And that's why he called it originally the Webster breech turning technique. Later on it was called the Webster in utero technique, and now it's called the Webster technique itself, but it's highly effective and so forth. And so what we want to do is always share with our patients and lay individuals and even in the medical community, once again, it's very safe. It is designed basically just to correct the pelvis, the sacrum subluxation through a chiropractic adjustment. Again, work with a ligament, relax everything, and if babies have the room, babies will flip over and have a more natural position for hopefully a more natural labor and delivery. See you, docs.